A new way to treat anxiety and depression. Cranial sacral. In the modern day and age, alternative medicine has come a long way, either in the form of naturopathy, Ayurveda, or different kinds of massage therapy. A part of their success can be attributed to the rising demand for such forms of unconventional treatment. It goes without saying that the prevalence of anxiety and depression among people has increased tremendously, and such forms of alternative treatments have shown to be effective with these ailments. Cranial sacral therapy is a form of massage therapy which is used to treat a variety of disorders, both physical and mental in nature. As the name suggests, this form of body massage therapy focuses on the skull and the sacrum, which is the bony structure found at the very end of the spinal column. As opposed to traditional massage therapies, cranial sacral therapy involves very gentle movements along the above-mentioned areas. The subtle touch is meant to realign the elements of the central nervous system into their correct position. This form of therapy acts both on bones and muscles in an attempt to revert any displacement that might have occurred from their rightful position. At the same time, the therapy also acts on areas with accumulation of excessive spinal fluid. The removal of this excess reduces pain in the head, back, and neck. Practitioners of this form of therapy believe that there is an inherent life force which permeates the body. They refer to this force as the breath of life, and according to them, it is responsible for the mental well-being of a human being. Cranial sacral therapy aims to facilitate the flow of this force, removing all obstacles in the process. As with all forms of alternative medicine, they are not meant to completely replace existing forms of treatment. Similarly, cranial sacral therapy is an additional form of treatment which can be carried out alongside traditional forms. The primary purpose of this therapy is to find the cause of the problem and subsequently treat it. As the mechanism involved in the therapy does not clash in any way with traditional treatment, a patient can have both quite comfortably. Besides treating anxiety and depression, cranial sacral therapy is also employed to treat head and neck pain caused by migraine, chronic fatigue, and motor coordination impairments. It has also shown successful results with physical disorders like scoliosis, spinal cord injuries, and temporomandibular joint dysfunction. Clearly then, cranial sacral therapy has its distinct share of advantages. It is completely non-invasive. One can receive it simultaneously with traditional forms of treatment, and it has no prominent side effects. To top everything off, it has a calming and soothing experience both on a physical and mental realm. Having said all of that, you must always consult a doctor if you are suffering from anxiety or depression.